So we spent a little over 10 minutes working on his left talocalcaneal joint, his right knee, and his pelvis. And now we have much freer abduction motion of the heel, and we have eversion, mobility there. And you'll recall that he was inhibited. Lift the foot up and out. Okay? Don't let me break it. Hold it there. And I'm not able to break it, so that inhibition has been removed. And the patella now has much freer mobility. I can come underneath it, and I feel like I dig a little deeper. Do you feel that lift up a little bit?
Yeah.
Okay. And I can glide it inferiorly. Now I can take up the slack. Now I can spring it, and it recoils. And the ilium is much more symmetrical. I can take up the slack, I can spring it, and it recoils. So that mobility is better. And we showed you the self-treatment, but we'll film you. You'll have your own copy of the film to remind you of all of those simple treatments. Okay. Can you tell us how you felt now that you walked up and down right after I treated you and you sat and tested it?
Yeah, it felt a lot better. Just walking more like I was walking on level ground. That's probably my biggest symptom. Feels like the back has kind of released a little bit of the tension there, which feels good. And then I don't feel as rotated when I'm standing up, straight up and down.
Very good. And how did your ankle feel when you were walking?
I mean, I usually don't feel too much there anyway, but it definitely didn't hurt. Yeah. I guess I don't pay very much attention.
Sure,
to
that's
it.
okay. That's all right. But we did two other things that I think are important.
Yeah.
We added a lateral heel wedge. So this tapers downward, and this goes on so the high part of the wedge goes in the shoe, so it's shaped like the heel, and so it encourages you to go into a little more pronation in the rear foot, which also encourages midfoot pronation. And so we put those in your shoes. How did those feel?
That felt amazing. Yeah. I mean, that felt, again, like I'm walking on level ground, which is
nice. And this is a 6-degree wedge. You can buy these in a 3-degree, 6-degree, and 9-degree. And so the 6-degree seems appropriate for you. And it's amazing how many people have custom orthotics, and yet they still benefit from either a lateral wedge or flip it over for a medial wedge. I hand these out a lot, and we have them tested. I don't just hand them out. We test it to see if it makes a difference, and oftentimes it's very helpful. The other thing that we did was we noted that your hip flexion is only to about 95 degrees. So you have a little bit of overhang of your labrum in the hip. And so we tried a balance pad. This is 2.5 inches tall, and it's pretty solid, firm. It gives a little bit, it's pretty solid foam. And so we use this for sitting, and so I recommend that he takes that with him whenever he sits in a low seat, such as the restaurant chair. So, very good. I think we accomplished much. This is a one-visit thing. Your travel, you have to fly back.
Yeah.
So, it's a one-time fix, but I'm comfortable with it. I feel like we did what we needed. We treated what was treatable, and also taught you how to self-manage it. So I'm very comfortable with this one visit.
Yeah. Thanks.
Good. So if you would just pay me 10% of what you've paid everyone else.
Oh my gosh.
5%.
That would come out to a lot. If you took 1%, that would take, you could retire.
I'll take 1%. Thank you very much.